So, I want to talk a little bit about rolling patterns. Rolling patterns are one of my most favorite ways to really get people to change how they think about moving and stabilizing themselves. And rolling patterns are really cool because once they go really, really well, they are self-rewarding, right? So they'll either feel really, really good to the point that you're like, there's no reason for me to do these. I feel great. Or they're going to be extremely frustrating and difficult, and you're going to keep working at them until they're easy to do, and voila, you're feeling better. So the really interesting part is why they work. So what I'm going to do is I'm going to do a little bit of anatomy chat real quick to give you an idea of what actually is working when you use rolling patterns well, and then I'm going to show you the rolling pattern. So something really important to think about when we talk about stabilizing the spine is that the spine, when it's just the bones as a stack of bones, is actually not a very stable structure, right? If this wasn't held together by whatever plastic pieces are in here that keep it adheres together, it would crumble, right? So these bones, if they were stacked one on top of each other, have no reason to stay together whatsoever. Their structural soundness certainly will come from some of that joint congruency. It will come from how these are big and thick and heavy and they fit really close together. And these up here at your neck are very thin, very small, and they fit they slide and glide a lot more easily. But what actually keeps them stacked together, what actually keeps them working as a unit, is all of the intrinsic musculature that runs all along here. So you have what we would refer to as intrinsic musculature. These are muscles that run literally from space to space, right? So all along here, from joint to joint to joint, are these little tiny muscles. And they run here, and they run here, and they run here. They're very small, and what they do is they work on a micro level at a pretty constant rate, pretty much all the time. As long as you are weight bearing, they're on. And they control the stability of these units. They do help provide guidance for rotation and flexion and extension, but that's not their job. Their job is to stabilize the spine and to keep it feeling comfortable. Now, you do also have some bigger muscles like the psoas. The psoas attaches at these lumbar units and runs down and attaches to the femurs. The psoas, while certainly is a mover, it will move the femur. More interestingly, is it's a compressor. So as the psoas muscle, one of the hip flexor muscles, contracts, it actually creates downward compression of the spine. So it truly stabilizes the spine as well. So in other words, this unit, this big wiggly unit, is okay to be wiggly, right? It's okay to be fluid and to bend and flex and move, as long as the units that are small, the intrinsics, are engaged and able to stabilize the spine. When those units are not the primary stabilizers, when your body is not very good at holding those still, you will start to seek these external units, right? You'll start to seek the extrinsic muscles. Those are going to be those big tenderloin muscles on your back, the ones when your back is so tight, you feel these big ridges on your spine. Those are like the erector spinae, right? Even your lats, sort of. On the front, of course, you have those six-pack muscles, the rectus abdominis, you have those obliques that come in. Those muscles certainly help to provide stability to your spine, but they're movers, right? They're movers. So when they contract, something moves, right? Whether you twist your spine or extend backwards, right? Or you flex your legs or extend your legs. So when those muscles contract, they may provide you with a sense of stability, but what you're really doing is you're constantly resisting motion all the time. So if you are, say, somebody who has a hyperlordotic back, right? You sway into this position all the time. So now constantly you're trying to suck your stomach in to give you some sense of control, because your psoas really is, every time it contracts, it's not able to provide that compression downwards on your spine, right? The psoas no longer can do its job. So now you're starting to contract your rectus, your six packs. You're constantly sucking your gut in, which does nothing for the spine, but it does create some sense of stability. But it dumps your pelvis, right? So now when these muscles are contracting, those long erector spinae contract, your pelvis gets yanked into even more of an anterior tilt. So you're constantly working on this push and pull, which over time becomes painful. So now rolling. Why do we roll? The rules of rolling are quite simple. Say we're doing upper extremity rolling. From the belly button down, your legs are not allowed to do anything. The only reason that you roll them, the only reason that they go, is because they are attached to the rest of your body by skin. That's it. So there is no lifting your leg up and over. It simply drags and flops with you. What you will see, you can stand in a room full of people and have them do it. You'll see some people just slither over like a snake, and it's beautiful and it's quiet and it's easy, right? And they just kind of go, no big deal. Then you have somebody over there who already has said, by the way, like, I have these postural problems, I have back pain, I have neck pain, whatever it is. And they go to roll over and one leg will kick up. They keep kicking a leg up to lift them over, or they shove a leg into the ground. Or when they come over, it's this big bam, right? It's a very loud unit of flop from one side to the other. And what that tells me is that their spine doesn't have the intrinsic stabilizers, right? So follow me. Here we go. If you are someone who's not very good at recruiting intrinsic units, you inherently, your body knows that the spine does not feel like it has the support it needs to fluidly move, right? It's all it wants to do is to keep you from getting paralyzed. So it protects the spinal cord. That's what it wants to do, is protect the spinal cord. So if it feels like it does not have these intrinsic units to stabilize the spine, it will engage the outer units to brace, right? Remember bracing, like to brace it. But when you brace with those outer units, whatever those outer units are touching will move. So if you're somebody who stabilizes your spine by contracting your hip flexors hard, your legs are going to shove up in the air. If you're someone who stabilizes your spine by contracting your lumbar muscles, your back muscles, your hamstrings, if you're someone who does that, then you're going to shove everything backwards into the ground. So the drill is to learn how to let all that go and to give space for these guys to turn on. Let's show you what that looks like. So for upper extremity rolling, what you're going to do is from the belly button down, there's no motion, right? They don't act to help you. They're only going to come with you because they're attached to you. That's it. So quite simply, you lay down, flap the arms overhead. This arm's going to end up just being out of the way. So if you put it down here, it's in the way. So it's going to be up here instead. You always lift your head to look where you want to go. And then you're going to start reaching and breathing and reaching and breathing. Just allow the legs to be soft. If those knees can actually have a little bit of bend to them, great. So we roll over. Nice and easy. Now coming back is always tricky. People have a hard time figuring out what to do with their hands. I always imagine hitching a ride. So they're going to follow. Notice the eyes follow the hands. We roll back. And again, right here, instead of kicking the leg over, it just keeps following along. Right? What you will see when someone fails at this is some kind of, right? Or there, they get stuck. A lot of times you'll see about right here is they get stuck and they want to kick over to come over. In that moment of feeling stuck, that's the moment where you have to be patient, right? So if we're here and we're reaching, right, and we're stuck and we're trying not to use the legs, right, I'm not going to ask somebody to keep going over. I'm going to tell them, hang out, breathe, reach harder. Really, really reach as hard as you can until you can't reach any farther. It's that moment of patience. It's that moment of pausing, breathing, and working through it. Now, that being said, There are plenty of folks where this is so difficult that we're talking beads of sweat, red face, a vein popping, anger, right? They're really frustrated. And no matter what, they're not going to be able to get that because there's just so many barriers between them and this normal fluid motion. So we set you up for success in a way that is good, right? So we use couch cushions, bolsters, foam rollers, anything to prop you up. So no, you're not traveling as far. So say if rolling from your back to your front is super difficult, then what you do is you'd set up a pillow under your hips. So now you're only rolling from here, right? You're only rolling that far as opposed to all the way over. So you set yourself up within parameters that challenge you without forcing you to fail completely. The last thing I will say about this exercise is that the whole point of this exercise is not to build up a strong core, it's not to work out and get better glutes. It's not any of those things. It's actually to change your neurological drivers for posture and breathing and fluid motion. It's to change how you pattern stabilizing your spine. Remember, the whole goal is to actually allow the intrinsic muscles of the spine to give you support while the extrinsic muscles are doing nothing, right? That's patterning. That's not strength training, that's patterning, which means at some point while you're doing this, you may hit a block, right? A place where every single rep is starting to look worse and feel worse. Or you can't progress any further. Like you have done everything you can. It just feels like it's getting worse. That's your cue to stop. You've hit the point of fatigue. You might not feel tired because all you've been doing is rolling on the ground, but that fatigue is the neurological fatigue. Is your brain cannot make any more decisions about it. It's had enough. What your brain's going to ask you to do is be like, "Hey, stop doing this. Go off, go sleep. Sleep on it. Wait. Tomorrow let's try again, and by tomorrow if you've given me a good night of sleep, I will give you the pattern that you want." And that's usually what happens. It doesn't take much. So just be patient with yourself. It's a shockingly effective exercise for being something so dumb. Roll around on the ground. Let me know how it goes.